Welcome. What is fibromyalgia? What are its symptoms? How do we diagnose it? And how do we treat it? These are the four most important questions about fibromyalgia and the diagnosis that has become much more common recently. A lot of people have become familiar with the name fibromyalgia, so let's understand this together step by step. First, what is fibromyalgia? Fibromyalgia is a collection of symptoms. The most important symptom is the patient's feeling of pain in the muscles and soft tissues, along with a set of other symptoms that we will discuss as we answer. The next question. A person with fibromyalgia is more sensitive to pain than others. For example, if someone presses hard on my knee joint, I might feel pain and rate it as 2 out of 10, meaning it's mild pain. The same pressure, if applied to a person with fibromyalgia, might feel like an 8 out of 10 to them. This is the idea or the general principle. The brain becomes more sensitive to pain than usual, so even a light touch anywhere on the body can cause pain. Medically, there are certain spots we call trigger points for pain, distributed all over the body, in the back, neck, upper limbs, and lower limbs. When we press on these spots, the patient feels intense pain. It's very, very obvious. So what are the other symptoms of fibromyalgia besides pain? Many people have accompanying symptoms like what? Insomnia, or even if they do sleep, they wake up feeling tired and unrested, as if they didn't benefit from sleep at all. They wake up extremely exhausted, even though they should be waking up refreshed. Many fibromyalgia patients experience something called brain fog. It's as if there's a kind of mental fog or a problem with thinking. They're unable to concentrate well, which somewhat affects their functionality or focus, whether it's in studying, work, or life in general. A large number of patients may have symptoms similar to those of irritable bowel syndrome, gastritis, or cystitis. So we can say it's pain anywhere in the abdomen, and this applies to a large number of patients. So it's not just the muscles in the back, limbs, neck, and shoulders. Not at all. Some people might have this whole mix of symptoms. Many people experience headaches. A lot of patients also have anxiety, or what we call anxiety disorder. Some of them have depression and some have both, which is called mixed anxiety depressive disorder. And as you may have noticed, these are a lot of symptoms spread throughout different parts of the body. This can confuse doctors, and at first, we might not be able to settle on a diagnosis and end up visiting several specialties. If someone has stomach pain, we say it's the colon. If it's their stomach, we say it's a stomach issue. Let's test for H. pylori. Someone might have symptoms similar to depression or anxiety. So we go down that path further until someone connects the symptoms together and is able to imagine and suspect that it could be fibromyalgia. That was regarding the symptoms. Some people experience even more symptoms than that. For example, symptoms similar to those of a common cold, which is something we don't see often, but it has been recorded as one of the symptoms of fibromyalgia. Let's move on to the next question. How do we diagnose it? That's a straightforward question, doctor. Is there a test or scan I can do to know if I have fibromyalgia or not? The answer is definitely no. Unfortunately, there is neither a test nor a scan for it. So why do we request tests? If someone watching this video today has fibromyalgia, they will understand this very well. They've spent a lot of money on tests and analyses, and they are actually necessary. So why are they necessary? Because we use these tests to rule out any other cause. The symptoms can be confusing. At first, we don't know if it's a rheumatic disease, an autoimmune disease, or a psychological condition. So we request tests to rule out other causes, and that's the benefit of these tests. When the tests come back negative and we don't have any other suspect, this is a stronger indication that it's most likely fibromyalgia. And why do we say most likely everyone? Because as we said, there isn't a clear test for it, and there isn't a clear scan for it either. So we say it's most likely fibromyalgia. All right, let's move on to the next question and ask, how do we treat it? Doctor, does it have a treatment? Like, can I take a course of medication for 2 weeks or a month? Absolutely not. Treatment for fibromyalgia in most cases lasts for many years or even a lifetime. Because the main idea behind the treatment is for the patient to accept the symptoms and become aware of the disease and its symptoms, so that we can start trying treatment, whether it's behavioral therapy or medication. Our goal is to reduce the brain's sensitivity to pain or the brain's perception of pain so that an 8 out of 10 becomes a 6 out of 10 or even a 4 out of 10. This way, the patient no longer suffers in the same way. That's regarding the pain. There are also other symptoms we've talked about, like disrupted sleep, insomnia, or changes in mood, where we might experience symptoms like depression and anxiety. Now, let's talk about the aspects of treatment. Part of the treatment involves medication, as we mentioned, painkillers, whether they're mild, moderate, or very strong. Psychiatric medications are used to address the symptoms that might be present, such as anxiety or depression. The third part of medication treatment may address issues related to sleep, such as insomnia, restlessness, or not benefiting from hours of sleep. And after medication treatment, or the last thing in medication treatment, is that some patients refuse the medications when they find out that these are antidepressants or anti-anxiety drugs or psychiatric medications, meaning something related to mental health. What do you mean by that, doctor? I have pain and you're giving me an antidepressant. I'm in pain. And here we need to clarify an important point. Sometimes when we have pain that we can't control with regular medications, even patients who don't have fibromyalgia. By the way, sometimes we have to prescribe medications that are classified as psychiatric drugs, but psychiatric medications aren't only used for mental illnesses. They have other uses in medicine depending on the patient's problem. This brings us to the second pillar of treatment, after we've talked about medication-based treatment. The second pillar is for the patient to engage in regular activity and exercise at least 5 days a week. Ideally, it would be every day of the week. The muscles improve, becoming more flexible and stretched. The patient's sensation of pain usually improves with regular exercise and consistent activity. Some people also benefit from gym exercises, which we call resistance exercises, or by using certain equipment, not just for cardio workouts or stretching exercises like stretches and so on. Exercise in all its forms benefits fibromyalgia patients. Every patient has their own experience. Many patients say that when they did intense exercise, the pain increased, and some patients say that when the exercise was only stretching and flexibility exercises, the pain didn't really improve much. But when we increased the level of exercise, we improved a lot. And this depends on each patient and their experience with exercise. But the main goal is to maintain regular exercise, because in one way or another, it improves two things. It enhances the patient's mental state through its positive effect on the brain, and it also reduces the impact of stress on us in general. The final goal of exercise is that it also keeps the muscles and joints healthy and helps maintain flexibility and stretching. The third aspect of treatment is physical therapy, which is done with specialists whose role is to improve or reduce your sensation of pain through certain exercises. These are not general exercises that work for everyone. They are exercises that are tailored in detail for each individual patient. The last part of the treatment is relaxation exercises. We all used to think in the past that this was just talk and didn't actually work, and wondered, what are these doctors even saying? Do yoga? Really? And meditation? All these things back then, even when we were young, we used to say, what is this talk? But studies have proven otherwise. Patients' experiences have also proven otherwise because, as we mentioned at the beginning, a large part of the symptoms is related to how the brain perceives pain. Relaxation exercises also work on the brain and therefore improve the patient's perception of or reaction to their condition, as well as the patient's satisfaction or acceptance of their condition and symptoms, and the patient's acceptance of their problem. It also reduces the impact of stress in the patient's life, whether from the pain, the symptoms, or life in general on the illness. So these are 4 therapeutic pillars: medication therapy, regular exercise, physical therapy exercises with a specialist, relaxation exercises. Where can we find relaxation exercises? They're available on YouTube. There are many videos you can learn relaxation exercises from. So what's the take-home message from everything we've said? If I were to summarize everything I've said, fibromyalgia is not imaginary, because many patients are accused of just having psychological issues, that there's nothing wrong with them, and that they're just being dramatic, and that it's just a problem of stress or tension. No, this is a real problem. Just because there are no tests or scans for it, doesn't mean the patient is imagining things. We have to acknowledge their pain and symptoms and respect their problem. So yes, there is a real problem. The patient is going through it. It's important that we help them overcome it or cope with it. The second message is, when you have symptoms and you still can't figure out the cause by reading, by visiting some doctors, or through the tests you've done and still haven't found anything, go to a specialist so they can try to rule out or determine if it's fibromyalgia or not. The third message is that just because there is no definitive cure, that doesn't mean the patient will always stay the same. And this is a message specifically for the patient. No, the condition does improve with all the approaches we've mentioned. Have acceptance and optimism that you will get better, because that will also help the treatment be more effective. Always stay positive and optimistic, because even if the treatment doesn't make the symptoms disappear completely, it will reduce them significantly. And finally, thank you for your time. If you'd like us to make any videos on any topics, send us a message or leave me a comment on this video here. And if anyone has any questions about fibromyalgia as well, thank you so much and see you soon.